morning. I'm your doctor today. What is your name?
My name is Shruti.
What is your profession?
I'm a housewife.
So what happened to you?
I was cutting my nails and I accidentally cut my middle finger
When did this happen?
1 week ago.
So you visit any doctor at that time?
No.
Did you apply anything on the wound?
Yes, I've applied iodine.
So did the pain relieve after that?
No, I felt no relief. Also, my wound worsened with discharge.
Then did you visit doctor when the wound worsened?
No.
So do you have additional complaints like fever?
Yes.
When did it started?
5 days ago.
So did the size of wound increase after you injured?
Yes.
Okay. Do you have gastric ulcer?
No.
Do you have allergy to any medications?
No.
Do you smoke?
Yes.
Do you use alcohol? Take alcohol?
Yes.
Do you have any operations in the recent
No.
time? Okay. Do you have TB?
No.
Do you have myocardial infarction anytime in your life?
No.
Do you have stroke in any time of your life?
No.
Did you have blood transfusion
No.
recently? Do you have diabetes?
Not sure.
Okay, so I will do a test to check whether you have diabetes or not.
Okay.
Okay, I have identified your complaints and I can heal it, but since you have fever and chills, this is a sign of infection, so I need to examine your whole body and then.
Okay.
To conclude the subjective examination, the patient complains of pain in the mid finger of the right hand. She has injured her skin, and the wound did not heal on its own even after she tried applying iodine. The presence of discharge as well as fever accompanying it may indicate an infection. It is also suspected that the patient has panerythium, which is an acute purulent inflammation of the tissues of the fingers, but more tests should be done. Wound healing is also delayed in diabetic patients, but patient is unaware if she has diabetes mellitus, so more tests should be done in order to investigate further.
Okay, I give you GCS 15, but your hand conditions do not look normal. Let me check your joints and bones.
Based on the general inspection, patient does not have normal condition. Her Glasgow Coma scale, however, is 15. She looks of her age with normal skin, mucous membranes, joints and bones. However, as mentioned earlier, she has a fever which could indicate an infection. There is no dysfunction of the respiratory system seen in the patient. Everything was normal. Based on this chart, the blood pressure is stable, percussion, palpitation and auscultation is also normal, thus there is no dysfunction of the cardiovascular system. Based on the objective examination done, there is no dysfunction in the gastrointestinal system. Genitourinary system is normal as well. Urine output has normal color and volume, which is a sign of no renal dysfunction.
Yes.
Sensitivity increases, numbness increases.
After the objective examinations of the systems were done, it was important to take a closer look into the local status of the infected finger, which concluded that the local temperature of the finger was hot, numbness increased, and sensitivity increased as well. The capillary refilling time is normal, however, patient has edema on the middle finger. Patient also has ulcer on the wound. The patient's local status will be explained further in the next few pictures. On the frontal surface of the finger shows hyperemia and swelling. It is flexed and the nails of the neighboring fingers has black coloration. This indicates lack of hygiene from the patient. Dirt on the patient would have been the factor contaminating the cut on her nail and causing the infection. The orange stripes on the hand is iodine, which was applied by the patient with minimal medical knowledge. In the inner surface of the finger, there is a wound with discharge. This indicates inflammatory stage of the wound. Discharge could indicate presence of gram-positive bacteria such as Staphylococcus or Streptococcus, since it is coming from the skin surface. Based on the local status of the patient's finger, as mentioned earlier, it is an inflammatory stage of the wound. It is in secondary healing. It is an untidy and unintentional wound. It is non-penetrating and is without organ injury. Since there is a discharge, it may indicate presence of gram-positive bacteria. Thus, the treatment would be first-generation Staphylospirine, methicillin, and if these antibiotics are non-sufficient, then vancomycin.
Okay, so after inspection, I have come to the conclusion that you are suffering from flexor tenosynovitis, and for the conclusion, you have to do ESR test, some lab tests like ESR, WBC test, X-ray of your finger, and after the results are out, as soon as possible, within 30 minutes, you have to do surgery. Okay.
The primary diagnosis after the inspection of local status would be that patient has flexor tenosynovitis. This is due to the infection of the finger. So some lab tests must be done such as ESR, WBC, band, which is expected to show high levels in response to fighting an infection. Glucose is checked as patient is unsure if she has diabetes. Swab test is carried out to find out what bacteria is causing the infection. X-ray of the hand is also done. Surgery needs to be carried out as soon as possible within 30 minutes after the results are out. The lab results show high white blood cell count and band forms, which indicate the presence of infection. High ESR is also a vivid sign of infection. The urine test, glucose test, and ECG are normal. The swab of the exudate shows presence of gram-positive bacteria, which is Staphylococcus. The medical treatment here is antibiotics, preferably first-generation cephalosporin. Infusion therapy is not needed as patient does not suffer from fluid loss and her condition is still stable enough for her to tolerate oral intake. The diet of the patient would be low sugar diet if she were to have diabetes. The arm should be supported to reduce edema and dressing should be done. NSAIDs given to reduce inflammation and pain, and surgery is needed. This chart shows the steps of the surgery, which will be explained in the following video. The surgical treatment for tenosynovitis will be explained. Firstly, carry out aseptic technique, which is prepping and draping. Then, intravenous anesthetics such as ketamine will be used in this case. Local anesthesia would not be much use here as the severity and the location of the wound is not suitable for it. Then, a long incision is done from proximal to distal phalanx from the side of the finger. The video shows a contralateral incision, which also can be done to allow better drainage of the pus. Both methods are correct. Then, irrigation of pus is done. It is evacuated. Passive draining of pus and excision of necrotized tissue is done. Wound is not sutured and left for secondary healing. It is then dressed. Focus of the infection is now removed. First generation cephalosporin is given to the patient for 7 days and is given once at 7 a.m. and another at 7 p.m. to ensure the medication is given consistently. With antibiotic treatment, intramuscular administration is done. To see how patient has responded to the medication and surgery, the ESR and WBC levels should improve, as well as the local status and temperature of the patient. Improvement should show as pus and necrotic tissue are removed and there will be no further intoxication.